let me hand it over to Ricia.
Thank you so much, Juan. As mentioned, I am Rocio Gonzalez, the Community Engagement Manager for the program Public Health here at UC Irvine. And it's a pleasure to virtually meet you all. So I'll go ahead and get started. Let me share my screen here real quick. All right, perfect. Yeah, so I'm here to discuss with you about the program in public health. We are part of the Susan and Henry Samueli College of Health Sciences. As you can see, this is our new building here. We're located in Irvine off of California and Bison, so not too far from IVC. This is our team, just so you can kind of get to know all of us in student affairs here in public health. So apart from myself, the community engagement manager here, I assist with our practicum, which is our internship programs, as well as engaging in the community and research opportunities. We also have our wonderful director, Jacqueline Baruga, of student affairs, our director of undergraduate affairs, Dr. Theodore Gideons. We have an assistant director, Gabriella Pham, in graduate affairs, as well as a senior graduate advisor, Jen Crum, and they make up our graduate team. We also have a wonderful, robust undergrad team. So we have Denise Leon, our senior undergraduate advisor, Jackie Osegueda, another senior undergraduate advisor, Megan Padilla, another one of our undergraduate advisors, and Arturo Razo, another one of our undergraduate advisors. As you can see here, the majority of the team is first gen, so that is definitely something we pride ourselves on, knowing that we're able to engage in the community, really relate to our students, and let them know that, hey, we've been there. So we know that it's a process, but we're here to support and guide you on through. So what is public health, right? Often everyone's asking, what is public health? I know with COVID-19, it did kind of answer a little bit of those questions, but the CDC said it best. Public health is a science of protecting and improving the health of people, their communities. Overall, public health is concerned with protecting the health of the entire population. These populations can be small, like your local neighborhood, or as big as the entire county and region of the world. So that's a little bit of what is public health. In our program, we pride ourselves on really preparing. So research, discover, teach, and heal. That is our motto, trying to make sure that we are at the forefront of prevention. That is what public health is, ensuring that we can assist those prior to any issues, and then figuring out, once we do have concerns, how can we best support. So who are we? Right here at the program Public Health, we do have 4 departments here at UCI: Health, Society, and Behavior, Population, Health, and Disease Prevention, Environmental Health and Occupation, as well as our Department of Epidemiology and Biostatistics. Of these 4 departments, we have the pleasure of having 2 undergraduate degrees with 3 minors. We have a BA in Public Health Policy, a BS in Public Health Sciences. That is a degree that a lot of our students who are interested in the medical field really prefer. So I'll kind of get into a little bit more details on that in a moment. A minor in Health Informatics, which is a new up and coming field that we're definitely seeing a lot of our students who are interested in. A minor in Public Health, and a minor in Global Health. We also offer 6 graduate degrees, so a PhD in Public Health, a PhD and MS in Environmental Health Sciences, a PhD and MS in Epidemiology, and one of our larger programs, our Masters of Public Health. We are a fully accredited program through the Council of Education on Public Health, as well as a member of the Association of Schools and Programs in Public Health, also known as CEF and ASPPH. So this is a little bit about our public health. What is public health in policy, right? So if you are looking to get into the program in public health, and more specifically in policy, your BA in policy, these are just some of the requirements. So you'll notice that a lot of our students, especially if they're starting off here in their first and second year, will take their intro courses into public health, some lower division courses, statistical courses, as well as social and behavioral science courses. A lot of our students who are coming in through transfer programs or a school such as IVC will usually jump right on into our upper division requirements. So you're looking at the 5 public health topic area courses. Those are areas or courses in the topic area of your interest and that field within public health. We have 8 additional upper division courses that we require all of our students to take, one of which being public health practicum and the culminating experience. The exciting thing is we are only one of about 4 programs on this whole campus at UC Irvine that require practicum or an internship experience as part of the program here. So it's really exciting. So when you graduate, you not only have your degree in public health, but you also have some experience, some work experience firsthand in the field. Our public health sciences degree looks a little like this. The lower division requirements that you'll notice are very similar to the biological sciences degree that we have here at UCI. So you'll notice that if you are thinking of double majoring, we do not allow, or it is not accepted to double major in public health sciences and biological sciences. And the reason for that is that they're a very similar degree. So you'll notice that if you're on that pre-med track, we require all of the same courses as biosci, meaning that you will be prepared for then to be able to enroll in medical school, nursing school, pharmacy, just a little bit of everything in that med field, right? So we have those 5 biological science courses, general chemistry as well as labs, organic chemistry and labs, introduction to public health courses, which is the same as our public health policy, social and behavioral sciences, and then the addition of a required 1 year of math in a specified math course. Our upper division requirements, so this is what our students who are, again, transitioning from a community college or maybe transitioning from another 4-year university are required to take Public Health 101, which is an intro to EPI course, 2 biological science courses, our 5 upper division writing courses, which is similar to the public health policy, and then same as policy, the culminating experience and public health, which is our practicum. So a little bit of information on what are the differences, right? For those incoming students, are we able to transition into public health sciences or policy or vice versa? So if you are a first year student, so coming from a high school campus, we most definitely can transfer you in. We also allow incoming transfers, and we do that on a rolling basis. Even if you're already, say you transfer from IVC or from, high school in, and you're in biological sciences, maybe history, nursing, whatever the degree is, and you decide, you know what, maybe that's not for me. Maybe I want something that's a little bit more broad. Give me a little bit of more experience on a whole within health. We definitely take that. We definitely ask that you reach out. This is our email that is provided to all of our students, PHUAO or Public Health Undergraduate Academic Affairs at uci.edu. You can get a little bit of information about all of our programs, how to transfer in, what our requirements are, and all the nitty-gritty. We do have some information on the difference between our BS and BA here, and then if you're transferring in, what to expect and kind of how to prepare. So for both degrees, you're going to want to transfer with at least a GPA of a 3.0. That is normally what we're looking for. We do take lower than 3.0. We definitely take that holistic approach. So we'll want you to send in all your information if you have some letters of rec, but definitely usually a minimum requirement is 3.0. We do require that you have some courses already completed. So especially if you're in the biological sciences, you want to have 2 of those UCI BioSci courses completed and 1 year of general chemistry. Which would be 2 courses at a semester school. On the policy side, we just require that you have 1 year of social and behavioral science courses completed. We do take appointments in June, preparing you to then begin in the fall. If you do have any last minute questions, if you want to transfer over to our program in public health once you're already part of UCI, definitely always ask you to reach out and get a little bit more information so we can prepare you and get you with your best foot forward. So pre-health students, common courses that we notice that students ask, how should I be preparing? What should I be taking? So you definitely always want to take that 1 year of general chemistry with the labs. And I can't stress that enough. You definitely want to make sure you have the labs in there. The 1 year of organic chemistry with labs. and your biological sciences with labs. Calculus and statistics is also something that we require. So it's definitely something that would benefit you on transferring over, making sure you're prepared with that slate. And then 1 year of physics or anatomy with the lab. That is not a requirement, but it's definitely something that that will prepare you for pre-health. It's not something that we require for our degree itself, but it's definitely something that we say to our students who are interested in pre-med, who are going to apply to medical school, nursing school, or the pharmacy school, to definitely go ahead and, get ahead of the game, take that 1 year of physics and anatomy, get those labs ready, so you have your best foot forward and you're ready and prepared when it's time for application season. So now a little bit about our graduate programs. So as mentioned, we do have 6 graduate programs, which is really exciting. Public health, PhD, Master's in Public Health, Environmental Sciences, MS and PhD, and the epidemiology degree in MS and PhD. Each course will have, or each program will require a different length of degree, as well as courses. We do have different concentrations for our PhD program in public health, meaning or being disease prevention and global health. Currently, for our master's in public health, we do have 4 emphases: socio and cultural diversity and health, environmental health, epidemiology, and biostatistics. Those 4 concentrations are getting a revamp, and we're hoping that in, if not this coming academic cohort, next year's cohort, so 2024, coming in, we'll have concentrations, and we're going to be adding some concentrations in health policy as well. Our environmental sciences, MS and PhD, we have different tracks there. So environmental toxicology, exposure and sciences, and environmental epidemiology as well. And then for our EPI courses, it's 1 standard epidemiology degree. As you notice, our MPH or MS degrees usually have a timeline of about 2 years. We do have programs where we have you can do your MD as well at the same time. So an MD-MS or MD-MPH, those are usually consolidated into a 1-year program, but that's definitely something we offer. And then our PhD programs, you're usually on the track of 5 years. Some students can complete it as quick as 3, but generally speaking, it's around 5 years. Here's just a little bit more in-depth information on our PhD in public health, which is either disease prevention or global health. It is 84 units total. You're looking at a minimum of 2 quarters of teaching. So that's something really exciting, that when you graduate with your degree, you do have that teaching experience. You will have to present a dissertation to advance and complete your degree. The nice thing about this degree, or all of our PhD degrees, is that they are fully funded by the program. So if you are accepted into the program, it is at no cost to you. We have tuition reimbursement for all of our students in our PhD programs. Our MPH program, or our Master's in Public Health, so just a little bit more information here. This is usually a 2-year program. It is a requirement that you complete practicum as well for a master's in public health. So it's really exciting that we offer that capstone experience. Through practicum, we do also have a community engagement or networking component where we really help connect you to those public health opportunities. Some of our internships are paid, so that's a really nice experience. And we do offer professional development as well through this program, since our MPH or Master's of Public Health is a terminal degree. So we're hoping that all of our students are, hit the ground running and really apply that practice into public health. Some of our MPH students do go on to med school, others go on into the PhD programs for academia as well. So here's a little bit more information on requirements for environmental health sciences, MS and PhD. Again, all of our PhD, while there is 2 tracks here, all of our PhD programs are fully funded. So that's something really exciting that the university offers. Our MS programs, we do offer stipends, as well as the MPH program and other opportunities. As well as TA and reader appointments, which means that you do either get some sort of stipend towards your courses, or you can also be paid through the university as well. And then a little bit more information here on our EPI and PhD. Again, 2-year timeline. PhD is 3 to 5. We do have different concentrations. A lot of our students in our PhDs and MS programs are looking into, different opportunities. Some are going on into academia, some into the private sector. And I'll go over a little bit about what all of our students and programs, what they have to look forward to, right, when they graduate our program. So how they break into public health as a career. Another little thing we like to promote is that we no longer require the GRE. So that's something nice. Our PhD programs, MPH, MS, and epidemiology do not currently require you to complete a GRE. We do have new English proficiency policies, and this will be geared more towards our students who are international students. So that's just a little information on that. And then public health practicum. So as mentioned, we are one of the 4 programs, I think, here at the university, if I'm not mistaken, business, education, ourselves, public health, as well as social ecology require some sort of internship component as part of their degree. And public health specifically is one of, as mentioned, one of the few degrees that offers it. Our students gain a hands-on experience in an approved organization in the field of public health. So we do have a guide of approved sites that we work with. Here are just some that you can see here that we currently work with. It's just a small group of them, but we currently, there we go. We currently have an MOU with the Orange County Healthcare Agency, as well as the National Council on Alcoholism and Drug Dependency, St. Joseph, Latino Health Access. We're currently in the process of completing our MOU with Public Health LA, so Los Angeles County of Public Health. We also have worked in the past with San Bernardino County, as well as Riverside County in Public Health. And we're always trying to offer our students a robust selection of programs to apply to within public health. Our undergrad students specifically, they are required to complete practicum in their upper division standing years, so either junior or senior, and it is 100 hours over the course of 1 quarter, so 10 weeks, which averages about 10 hours per week, where the difference is our graduate students are required to complete practicum over 2 quarters and are required to complete 180 hours, which ends up being about 10 to 20 hours. There are differences in requirements. We do meet core competencies through our accreditation standards with CEEF and ASPPH, but you're definitely working on a lot of things within the community. Our undergraduate students are working on grant proposals. When they graduate and complete this program, they have skills in grant writing, policy analysis. They're able to complete a literature review, as well as presentation skills, and then that hands-on experience in public health, where graduate students work on different accreditation standards, but are able to really immerse themselves in their practicum program and be part of the organization, help on a larger scale, oftentimes working with large data sets, social media campaigns within public health, health promotion, health diversity, policy and equity. So just definitely really getting out there and making those big changes in the community. So it's really exciting. And these are some images from our students and some programs that they've been a part of. So student support and programs in public health. So another reason why we think it's great to be part of public health and our program specifically is we offer orientation to all of our students coming in, mixers and gatherings. We survey our students for wellness. We offer professional development, and we definitely offer that holistic approach. So some professional development opportunities, we love our students to take advantage. We have mentors for our students. We have alumni events, and we like our students to be part of our program and continue on with us. So really good to see what public health is about specifically at UCI. We offer our students opportunities to attend conferences and different resource centers throughout campus, as well as Division of Career Pathways. So we have this wonderful relationship with Division of Career Pathways, or DCP as we like to call them, and they offer us wonderful opportunities to get our students really ramped up and ready to be into the job market, preparing their resume, getting those cover letters ready, working on those interview skills. Through our courses, we offer panels, as well as inviting division career pathways out to present on all the wonderful things they know and getting us ready. So why public health? Why do you want to be part of public health? So currently, there has been a change in demographics, specifically in Orange County, which means that it is more diverse. And this offers us a bevy of experiences and opportunities in public health. So as the population gets older and continues to grow, this is a larger population, Orange County, that we can then really research and apply to through gerontology and different programs in public health in general. We've noticed a large effort in programs with aging through the county and our experiences in working with the county. We're also turning into a more diverse population. So racially, we have just a larger community of diverse individuals. So we're really able to immerse ourselves in those different pockets within Orange County. And the lovely thing is that Orange County is such a large county, so diverse, that you can really immerse yourself in the Latin community, Asian American community, and just a little bit of everything, right? So we have all these different opportunities, not only with the county, but in the private sector to really research and make these advances in public health. So health equity and diversity in Orange County. So as mentioning, this is just a little graph, the risk and vulnerabilities that come with such things like COVID-19 and other areas of epidemiology that we're able to support through public health. So we've seen that our students are able to, especially in environmental health, see how is our water, how is our air quality, and those are just other opportunities for our students to then immerse themselves in public health, find careers, do that research, and be part of the community. So then a little bit more about public health. If you're interested, we are a growing field, and pursuing a degree in public health is essential. It's really what keeps us safe, keeps us thriving within our communities. There are government agencies that are looking for our students, nonprofit organizations, hospitals, business administration, research education. So these are just a little bit of the organizations we continue to work with, and we see that our students and alumni are reaching out to us and letting us know that they're working with these organizations. So County of Public Health, CDC, Community Health Initiatives, CHOC, Orange County Healthcare Agency, different consulting firms, and Abound Food Care. So that's a nonprofit. As we can see here, a lot of our students are really growing and finding all of these different ways to branch into public health. We've definitely seen a growing field in informatics as well as consulting. A lot of our undergraduate students, when they graduate, end up going into one of these fields. So biostatistics and informatics, becoming analysts, biostatisticians, statisticians, communications, so getting into public health journalism, or more a larger social media approach is what we've noticed a lot in public health as well. Going into community health, so being program coordinators, public health educators, teachers, nurses, emergency management, environmental health, so engineers working on the state and federal level as well. Mental health, so working in health and wellness organizations as managers and global health careers. Working in research, so HIV, AIDS, epidemiology, COVID-19. We've seen a lot of our students working in those areas. Working as database administrators, medical practices, so public health nurses, administrators, working in health education, so working in student affairs as well, as we've seen that as well, and social and behavioral sciences, so evaluation specialists, consulting in that form. Our graduate students, MPH specifically, that we see that go straight into practice, and our PhD students as well, will go into consulting in some way, shape, or form, but normally end up in academia as well as research. And then our MPH students specifically, health educators, biostatisticians, epidemiologists, working with communicable diseases, research analysis, community-based organizations, analysts, leaders in the community, program managers, public health information officers, health equity specialists, and health department directors. So these are just a few of the jobs that we've seen that our students and alumni really get into and immerse themselves. So as you can see, public health is really growing, and there's a large need, not only in the private, but in the public center for public health professionals. So where are we going? We are growing. Now that we're part of the Samueli College of Health Sciences and soon to be the School of Population and Public Health, fingers crossed this coming academic year or academic start in the fall, we are growing. So we're definitely getting a lot larger student body. Our leadership and faculty is changing, having that support of that multiple disciplinary approach. More faculty means more areas of research to really immerse yourself in. And then our new space. So as mentioned, we're located off of Bison in California here in Irvine at the Susan and Henry Samueli College of Health Sciences. Why choose UCI? We're ranked number 8 of the best schools for public health specifically. We do offer various fellowships, about $62 million worth of fellowship funding across the board in our program. It is one of the safest places to be, and we have a diverse community, not only in research, but in our student body as well. We are a large Hispanic serving and Asian American serving university. We're number 31 across the School of Programs in Public Health in UCI, or the US in general, not just within California, number 8 in California. But we do have a large student body of undergrads. So close to 1,500 undergrads, as you can see here, 1,300 to be exact, 200 graduate students, 175 faculty and staff, and growing. This year, our MPH cohort is going to be close to almost double what we had last year. So we're definitely growing, and it's really exciting. Definitely have a large population of international students. So that is something really exciting as well that we love to share. And 50% of our applicants are first generation grads. So that's an exciting thing for us. We often have a lot of our students as well that we like to call anteaters squared, that come through the ranks of our undergrads and then go into our graduate programs. And we're located in the heart of Orange County. Here's a little bit of contact information. As you can see here, this is our staple or campus on the actual university grounds. So Air B, or Anteater Instruction and Research Building. We house most of our undergrads here, or our undergrad student affairs. And then at the College of Health Sciences is our building where we house all of our students. So undergrads, grads, and PhD students alike, as well as staff. We have office hours Monday through Friday, generally speaking 9 to 4 p.m. And those are our emails. So PHUAO is if you're interested in undergrad. PHGO is if you're interested in grad, all at uci.edu. Yes, so now I'll go ahead and stop sharing my screen, and I'm going to go into questions. Okay, let's see here. Perfect. Thank you. So I'm going to look through and see if there's any questions first in the chat, and then you're also welcome to, unmute yourself and ask a question if you do have one. So I see here. Okay. Oh, yes. So there's a question about our medical school degree as well as our MPH. So oftentimes our students are in dual degree programs. So we have a partnership with the medical school here as well as with the law school. So we have something called an MD MPH and a JD MPH program. So what that means is when you graduate, you not only have your MPH, but you also have your medical degree, or vice versa. You have your MPH and your JD degree or judicial degree. And the reason for that is a lot of our students are interested in public health as a whole. So when they go into these fields and they're in the medical school or the law school, they want to be able to have that public health approach, right? Which is a little bit of everything. So learning about the community, specific research. Some of our MD students like to go into epidemiology and specifically. So how can they get into research? How can they be more marketable? And it just really provides you that additional step into public health and understanding our communities as a whole and how we can best serve them. So it's something that we often see. And the nice thing is because we have that partnership, it makes it really seamless to transition between our program and the medical school as well. And then I see here, William, you have a question?
Yeah, hi. So my question is about the UCI bachelor's in public health science. That I'm in community college right now, but my dream school is UC Irvine. So
Oh,
my question is,
fantastic.
what's the difference between the masters of public health? Because I want to go to medical school, so I could choose that too, but I think getting a bachelor's in public health is great if I don't get into, master's program.
Mhm.
It's tag eligible. So what's the difference between getting an MPH in public health and doing this bachelor's if some school doesn't offer this as a
Yeah,
bachelor's program?
wonderful question. Wonderful question. So the undergraduate degree or the Bachelor's of Science in Public Health Sciences, right? That degree is really what you need to get into med school, right? It covers all of the requirements, prereqs, all that good
Yeah.
stuff. So you don't necessarily need your MPH to then get into medical school. We just offer a dual program. So not many schools offer that, but thankfully, because we are part of the UC system and have this great medical school, UC Irvine, to back us, we're able to offer these wonderful programs where it's really a transition and it's a seamless transition where while you're in medical school and it is not required that you get your MPH, but you can then also have your master's in public health, allows you that it's just an extra step really to have more experience and knowledge of public health as a whole, and it allows you to concentrate or have an emphasis in a specific or desired research area, and that's what we see that a lot of our MD students are interested in. So whether that be epidemiology, environmental health, many of our MD and PH students are interested in social determinants, so going into that concentration as well will assist you. While it is not required, it is definitely something that you can decide to do once you're in medical school, right? So you don't necessarily need to be in the master's in public health first. You can go to med school, then apply for the MPH, or vice versa. One is not required by the other. You definitely need your undergrad and you need to get all those core courses to allow you to be accepted into medical school, but it is definitely something that stands alone. Many students who go into a master's in public health, it is a terminal degree as we call it, which means that when you graduate, there's no need to go into medical school unless you're looking to become a doctor or go on to your PhD. It's a practicing degree. So what it helps is really prepare you for being in the field, being a public health director, working for the county, working with different nonprofit agencies, being in those leadership roles. That's what this degree is really helping and benefiting our students with. And same with our students in the MD degree. I hope that answers your question. And I see here, so is medical school required for a degree or master's degree in public health? Again, no. The MPH stands alone, but it is something nice to have if you're in the MD program and looking to be in more of a leadership role eventually as a medical professional. Can an MD graduate? Let's see here. So can an MD graduate from Europe get into the public health program? Yes, yeah, just apply. You'll need to send in your transcripts since we do take international students. Send in your transcripts, apply. We do have more information. Our applications for this coming cohort have closed. We are on a cohort system for the master's degree as well as our PhD degrees, but you are able to apply for the next coming cohort, which would be 2024. Can transfer student applicants get accepted into the department and change majors? Yes. So you can change at any time once you're in the school, usually in the summer during orientation or transfer orientation. We like to call it SPOP. While you're here at the university, you'll have an opportunity to either stay with your group or then transition to another program. Now, not all programs allow transfers. during the summer. However, public health, we take transfers on a rolling basis. So that's really exciting. If this is something you want to transfer into, I would definitely say during your orientation, or even now to get ahead of the game, just reach out to us at phuao@uci.edu to get more information. And I'll type that into the chat as well. Okay. And then let's see here, more questions. I know we only have about 3 more minutes left, so I'll try to get these through them really quickly. So what are the benefits of being an EMT and applying to medical school? So I think it definitely depends on what your prerequisites are for the medical school that you're applying to. I would strongly suggest you reach out to our School of Medicine for additional information, but they do require a certain set of prereqs or courses. And I think the nice thing is about being an EMT or having an undergrad degree in public health, as that it definitely offers you a different approach, right? And we've noticed that is something that the medical school specifically is interested in. While biosci definitely offers a great track into the medical school, sometimes looking at public health and those holistic approaches is something that also interests the medical school and kind of sets you apart, right? So how can this degree help someone prepare for nursing school and the prereqs? So exactly like the medical school, we offer, or the biological sciences undergraduate degree, we offer all of the prereqs. You definitely can take them. I think it makes you more marketable because it kind of sets you apart from the standard degree, and then you can get into that program. It's also something that we've noticed a lot of our students who are interested in the nursing school, but it's very competitive, will start out in public health and then sometimes transition over for a double major or a double major in nursing while they're waiting, and have those 2 degrees, make you a little bit more marketable, have a larger stake in the community, right? To know. So what are initial jobs? I would say reach out to us. We can definitely always connect you with our internship programs. That's always a good way to start doing some research, breaking into the public health field. I always say it's not so much about what you think you love doing, but sometimes the nice thing is to find out what you don't like doing, right? So figuring out through internships and these volunteer experiences, maybe this wasn't the exact path I want, but now I can kind of chip away and see, where do I really want to be? Maybe we've seen a lot of our students who want to be front-facing patient care, quickly realize maybe they prefer admin or vice versa. So it's something to think about. Let's see. So, and we have about 1 minute left. So are the internships paid? It does differ. So some of our internships are paid, some of them are not. It really depends on the experience and what you're looking or interested in. Okay. Any last minute questions before we're finish up here? Just to be mindful of everyone's time. And it could be a question about our undergrad or graduate degree. Can a student doing the public health sciences major take pre-med courses at the same time? Yes, they can. And that is something that we strongly encourage. Working with our academic advisors, they'll set you up on a 4-year plan or 2-year plan, depending when you're jumping into the major, and really let you know where you're at, what you can do with the time that you have left, and then really how to prepare. They'll also let you know what courses can be taken at a community college, dually while you're taking your courses here in the undergrad degree.
So it looks like our time is up, but I really just want to say, CEO, thank you so much for coming and presenting to us today. You gave both students and also counselors such great information on your various undergraduate programs, graduate programs, basically the various pathways available for students outside of just the traditional ones that students generally think about, pre-med, nursing, and so forth, and also even how to basically still do public health, whether it be like an undergraduate, and still plan for graduate school or medical school and so forth. I myself was a UCI graduate, and as a psych and social behavior, they changed that now to psychological science. I actually did one of my internships at the healthcare agency, okay, because you're required to do internship. And as you were saying, to find out what you want to do or not do. After that experience, I said, hey, it's interesting, but I don't see public health for me, even though I had an instructor a professor at UCI say, hey, Tuan, I could write you a letter of recommendation for UCLA's School of Public Health and Public Policy, okay? But I decided to go the education route instead, okay? So for our students, definitely while you're both at the community college and at the university, keep exploring your options. There's so many different options for you in order to go into med school, pharm school, dental school. I'll give you an example. One of my friends, he actually was a social ecology major. So what's social ecology? It's actually a little bit of everything. And he ended up going to pharmacy school. Myself, I could have been with my psych degree, managed to go to med school if that was my track. Okay, so there are various options, and from what Rocio shared, there's so many different career options within public health policy. Please consider that as either a main option or a backup option available for you if you are currently in one of the other main tracks for nursing or for med school, pharm school, and so forth. The other thing too is for some students, maybe their GPA isn't where it needs to be for medical school. Gaining a master's, a post-bac or a master's in public health may also help increase your GPA. So there are various options. Please connect with your counselor students, if you need to. And I know that once you're at the university, there are a lot of advisors and counselors available, both within the schools and the departments, or there may be even pre-med or health professions advisors available to assist you out. Okay. So with that, we actually will be closing this session. Again, Rocio, thank you for your wonderful presentation. This presentation will be posted on Irvine Valley College's Transfer Center.